In this session, we're going to talk about the nasal breathing versus hypoventilation in terms of additions to pulmonary rehab in people that have dysfunctional breathing. So in the world at the moment, there is a lot of people with long COVID, asthma, anxiety, and these all cause issues related to hyperventilation, overbreathing, which then can lead to exercise intolerance, can lead to fatigue, lead to anxiety, and a whole host of conditions that might be related to chronic fatigue. And what this study looked at is looking at individuals who have gone through a pulmonary rehab process. So what that would usually look like in this study is over the space of 3 months, they would have 5 sessions with a physiotherapist doing some endurance work, some breathing exercises, and some strength and conditioning. Then at home, they were asked to do that 3 times per week. But they split the groups into 2 different groups. And one group was going to be doing nasal breathing exercises as addition to their pulmonary rehab. So walking up and down stairs, and also doing some nasal clearing out the nose. And another group was looking at what we call hypoventilation. So they were individuals who would practice 3 times a week for 10 to 15 minutes, slowing their breath down to less than 5 breaths per minute, and then having some breath holds on the inhale and exhale, and then breathing normally. And that would then lead to like an underbreathing, which is like a standard kind of thing for hyperventilation training. And they wanted to see whether there was any difference between the 2 groups. So there were 17 participants that were split into a group of 8 and 9. And what they found is they actually found no real difference between the 2 groups. So both groups increased their exercise capacity around about, I think it was around about 30%. Both groups actually reduced their breathlessness at max exercise by roughly around about 22%. So there was no change in the main outcomes. However, in the nasal only group, so the group that were focusing on nasal breathing exercise and also from clearing out their nose using washout techniques and focusing on keeping their mouth closed, they found a significant group difference in the Nijmegen questionnaire, which is a questionnaire that relates to symptoms of hyperventilation. So it seemed like nasal breathing maybe been a little bit better there, and also in what's called a SNOT score, which is kind of like how much capacity do you have just to breathe through your nose, which we would expect when someone's focused on nasal breathing. However, in this study, what they actually found was in a 6-minute walk test, which basically is the distance that an individual can walk within 6 minutes, both groups weren't able to complete the whole sessions nasal breathing only. So they found that individuals still required to open their mouth, and although the nasal breathing group increased that time till they had to open their mouth further, they still had to. So there wasn't a full nasal development there, or they hadn't gone through the whole adaptation process. They believe that this was down to stress, anxiety, and down to limbic kind of activity within the brain, which is going to then deliver more central command to breathing, increase in breathing rate, and therefore switching over to mouth breathing. So what they suspect is that the nasal breathing group, whilst it's the same as the hypoventilation breathing group, that it might be easier to implement this as a strategy within pulmonary rehab to help people with hyperventilation syndrome, and that the nasal breathing group can learn to regulate their amygdala and their hippocampus and their stress response through improving activity within the brain, which is something that they are going to go and look on into a new study. So this study was just a pilot study looking at feasibility to see whether there's a difference. And the fact that there isn't a difference means it's good. It means that we can use nasal breathing as a form of easy adaptation or change to help people with hyperventilation syndrome and still get improvements in both their breathlessness scores, their symptomatic scores, their reduction in their anxiety, and also the study suggests that improvements in their low levels of carbon dioxide, so the respiratory alkalosis that was occurring as well. So there's some positive takeaways from this, even though it's a feasibility study. There is some great things to take away. And I think that we can then look further at this group that are doing these studies to see what comes from this next. So quick summary of that paper, and if you have any questions, comments, anything like that below, drop a comment, and yeah, I'll get another study across to you soon. Thanks for tuning in.